the first thing before we start, just wanted to get an update from the Climate and Nature Emergency Working Group. So this is one of the forum has got one working group, which when we set it up, we agreed that the forum would, or the working group would bring back a very, very brief report to each meeting that the forum had. So we've got a very, very quick update from Jackie, who's the vice chair of that group. So Jack, over to you.
Well, just a member of the steering group really, but okay, so quick update. So there are now 12 parishes represented within the Climate and Nature Emergency Working Group. If your parish is not represented, please get in touch. We'd love to have more people involved. We have, I think, 25 on our long list, but not everybody can make it to every session. And we've had 14 sessions. We meet monthly on Zoom. At the moment, we've got 3 subgroups working on different areas, and I just want to give you a snapshot of what we're doing in those areas. So the Nature Protection Group is exploring producing guidance to councils on dark skies, and also on the ways in which a council can help increase wild areas within their parish, which might be by making sure that pesticides aren't used in verges or verge management, but helping to create wildlife corridors. So more will come through about that into the parishes over the next little while. The second subgroup is home energy, and that group has put together a newsletter, which will be the first in a series of newsletters, and this one is helping people think about their management of their energy in their homes over the winter period. They also have got quite a long way in a project that they want to interview 4 different people who live in the Chew Valley who've made significant improvements to their home efficiency. They've found the people who are willing to do it. They've worked out what they're going to be doing with them. They've found a filmmaker who's willing to film it. The sticking point is that they need £1,000 to pay the filmmaker. So if your parish, whether you're one of the 12 in our group or not, if your parish would like to put something in the pot to help us to get to that, then that will mean that we can have these films that local people can see and really relate to, because it relates to properties in the Chew Valley and improvements that other homeowners could make. And the third group is the Sustainable Transport Group. Last time I came, I reported to you about our Cross Valley survey of 410 households across the valley, over 1,200 people involved. That survey has been going out there into the system, and we've been managing to influence both Baines and Wecker through that information that's provided in that survey. So we've also been influencing in terms of the Sustainable Transport Survey, which we managed to get some changes made to because we were concerned about certain aspects of it. That's now been much improved. It's available on buses that are subsidised routes. So please, if you know people who use subsidised routes, please encourage them to fill that in, and the closing date is the 28th of November. And coming along the line, there is another survey or a consultation from Wecker about the A37 corridor and the 367, so Radstock. It's our chance as local people to get involved. So again, in our group, we will be making sure the message gets out there. We'll be lobbying and trying to make sure that we get the changes that local people want for that. We've also been working quite hard to make connections into local groups. So we've been speaking to local community bus providers and other providers. And we have a meeting scheduled in January now to meet Baines and Wecker, relevant people within Baines and Wecker, to try to explore how we might access the transport settlement money that has been awarded to Wecker. So quite exciting things happening there as well. Final thing is that as a group, we've managed to negotiate a monthly column in the Chew Valley Gazette. So look out for our working groups updates there as well. And if you can't be on the group, but you're really interested in it, please let us know your email and we're happy to copy you in to our regular emails that go out to parish councils. And if your parish council is not getting it, please let us know and we'll make sure it goes to your parish council. That's it.
Great, thanks, Jackie. And what we'll do is after the meeting, we'll send both round the link to the bus consultation, the supported bus service consultation, and the A37, A38 consultations as well. The bus one has been out for about a month and a half. It's just been really, we've had separate meetings about this, but it's been really badly handled, the actual consultation process. So fair play to Jackie and in fact to Dave Orme as well, and the Baines Rural Transport Group as well, for doing some work on that. So we'll get that out to you. Excellent, thanks, Jackie. Okay, so we're going to go straight into the matter in hand, which is about the winter presentations. So Alison, can you just chuck the slide up for me? So we'd really like to welcome both colleagues from the council, public health colleagues, and colleagues from the CCG to our meeting tonight to discuss the challenges that face us all this winter. So we're going to begin with a presentation from Will Godfrey, who's the council's chief executive, Mandy Bishop, who's the council's chief operating officer, Becky Reynolds, director of public health, Jill May, director of nursing, and finally David Wood and Councillor Dina Romero from Baines Council. So the meeting this evening is an opportunity for us all to receive an update on COVID, including the vaccine, booster, and flu, as well as to understand a bit more about winter pressures, particularly on the health and social care system, as well as other public services. However, it's also an opportunity for us to share any concerns or pressures that we are facing in our communities, as well as thinking about how we can all work together to play our part and build on our local strengths and resilience. At the end of the presentation, there'll be an opportunity for you to ask questions, but we'd also really welcome hearing more from you about any ideas, issues, or concerns that you have about your communities. And we're also very pleased to welcome a couple of other colleagues and council directors and CCG colleagues onto the call this evening. So Becky, I think you're leading, is that right? So
Chris, can I start?
Oh,
sorry, it's Will.
Oh, sorry, Will.
If I can start perhaps by just giving a bit of that context, and then then I'll ask Becky and others to follow. So as you said, we're very conscious that there are some quite significant challenges going on locally, nationally, internationally, and we think it's really important that we're as open and honest about some of those challenges as we can be. And today, what we're gonna go through is just a bit of analysis of where we are around COVID. Talk to you a little bit about how that and some other issues that are both related to that, but also some other more related but pretty structural issues are also causing us organisationally some challenges, and we just want to talk that through with you, and again be really clear about that and talk about how we can all work together on that. And then at the end we're just going to also just touch on the budget position, because obviously we're at the stage now where in December we will be starting that consultation process, and again it's important that we just outline the sort of the starting point really for people, so that when you see more about those proposals you've got a bit of an understanding of some of the issues that we've been trying to deal with. So hopefully that gives a bit of context. Like I say, if you'll just let us go through the presentation, and then at the end if people have got questions, then I think that's probably the best way to do it. So Becky, do you want to pick up first of all around COVID and related sorts of public health issues?
Yeah, sure, I will. Thank you. Hello, everybody. It's lovely to see people, colleagues, and the local people on the call. So I've got 2 slides to talk through that relates to COVID specifically. So I'm going to start just by giving a bit of an overview and an update of where we are with our COVID case rates and what the sort of trends are at the moment. So this slide that's in front of you now, you can see that our rate in Baines per 100,000 is 504. Now it's been running around that high level for a week or so, but it's come down from the very high rates that we had about 3 weeks ago where it was over 1,000. So it's been running about that for about a week. England, in comparison to our 504, England's rates are 415 per 100,000, and they've been increasing. So the rates for England have been increasing over the previous week. The Southwest rates are also seeing a slow increase, and they're about 517. So our rates are still high, but they're static at the moment. They've come down from their height, which is good to see. In terms of the hospital, we've currently got 37 patients in the RUH with COVID, and they're a mixture of Baines patients, Baines residents, and residents from outside of Baines. The table on the right is a reminder to me to talk about the importance of all testing ourselves. And just today, actually, there's been some new national comms that's come out that's encouraging all of us to test ourselves before what they're calling periods of higher risk. So if you're going to visit somebody who's ill, if you're going to visit an elderly relative in a care home or somebody who is in hospital, then at that point, we're encouraged to test ourselves with a lateral flow test. So that's trying to pick up people who have COVID, but who don't know that they have COVID. So what's on the right there is a mobile testing van timetable. So people can get these rapid flow tests from lots of different places. And the outreach offer that we have in Bath and North East Somerset is this mobile testing van, where we're trying to promote community testing and trying to take the van out to places where we're likely to reach priority groups. So that's particularly men, occupations that have got a higher exposure risk, people with disabilities, people experiencing homelessness, rough sleeping, people who have dependencies on drugs or alcohol. So it's trying to contact people and people who wouldn't necessarily always walk into a service. The timetable of the van is planned 2 weeks in advance. So this is next week. The van has been in this area before. So it's been in Chew Magna and Stanton View and Temple Cloud. And the people who plan this are very, very keen to have it come back in the area again. So if you do know of any places where there's space for it and where it could particularly meet some of those more targeted populations, please do perhaps let Sarah or either the public health inbox know. So if we could go on to the next slide, please. So the next slide is to remind us that COVID is with us and it's going to be with us for a little while, and we're all adapting to COVID being with us. So it'd be really great if I could ask you to support the messages out in your local communities that we're all making about making changes to the way that we live so that COVID has a minimal impact on how we live our everyday lives. Jill May from the CCG is going to talk in a little while about vaccination. That's one of our key messages. Do please get vaccinated if you're eligible for flu and for COVID, and if you're eligible for the booster for that as well. The advice is still to wear face covering in crowded and enclosed spaces. And there's new evidence that's coming out about the effectiveness of face coverings in reducing the risk of COVID. So they both reduce the number of respiratory particles that people breathe out if they've got COVID, and they reduce the number of particles that the breather breathes in if they're wearing a face covering. So please do encourage people in your community to wear face coverings if they're in enclosed spaces. If people have got COVID symptoms, the advice is the same. Stay at home, self-isolate and take a PCR test. And people can get PCR tests by either dialing 119 or by going online. And then we all know about let fresh air in if we're meeting indoors, and outdoors is safer. What we're trying to do in the public health team is really build up and bolster up our support to businesses and shops and small and medium-sized businesses, because so many people go into businesses and into shops and entertainment venues. So we are encouraging businesses to protect their customers by putting up posters encouraging the use of face coverings. And I do thank people and businesses that are already doing this and are continuing to do this. So to make hand sanitizer available and to try to make sure there's space available for people to walk and have a bit of space around each other. So they're the main messages. If I could just encourage and thank everybody for everything that they're doing. It's a long time that we've been going through this pandemic, isn't it? And so thank you to everyone who is continuing to take these measures. They are so important as we go through into Christmas and we go through the winter as we have more and more winter viruses. So all these measures will protect against other viruses as well. Thank you, Chris. I think we're on to the next slide now. Thank
Yeah, so we should be on to Jill's slides now.
Thank you. Certainly, I think what I really want to get over is that this year with the vaccine programme, it's been an incredible journey and it's been ever changing. And had we known last December what we know now, I think it's incredible that we've had the resilience of our primary care colleagues and those working in our large vaccine centres to keep going. So as Becky said, you know, we're encouraging those eligible to take up the booster because it does protect, you know, 90% protection of those symptoms in adults over the age of 50. The COVID booster vaccine has also just been put out for those aged 40 and 49. I would like to emphasise here that it's now available for people to book. They may not be eligible at this time because many of them may have had them in the sort of spring, summertime. So their 6-month period is not yet ready for that booster vaccine. And that 6 month is still very critical. We know that the announcement was that you could start to book at 5 months. It does not mean that you are ready to have your booster at 5 months. We have delivered 37,000 boosters across Bath and Northeast Somerset. I think a critical thing that we need to be mindful of is the number of people also that did have their first and second dose, over 90% in most age groups. However, there are still, and just to give you a figure, there are still something like 23,000 people in the Baines area still yet to take up the offer. So we continue to do something to encourage them. We have vaccination centres, I think close to where we know that using the national booking system has people haven't always seen something close to them, but we do have a number of venues across the patch. I know Chew Valley is a little bit of a distance away from the race course, but there are surrounding other large vaccine sites. Next slide, please. So this slide really just sets out for you, the word cohort simply means the age bands of people that are coming forward. And whilst we're doing the boosters, just to say, obviously those children aged 12 to 15 are also being offered that vaccination at this time. But you have these slides for later should you want to get a flavour of just what our percentages are. Next slide, please. So I think what I would just want to say here about some of the pressures, and then if I may, I'd like to invite Corinne Edwards, the coup for Baines, who lives and breathes this alongside our acute colleagues, community and local authority. I just want to say in this, recognising when talks about the infection rates, the numbers of people that are currently going to our hospital, we absolutely know, and we're seeing that the large majority of people who are actually admitted and quite poorly, are unvaccinated. So whilst there are some absolutely that have had been double vaccinated, we are seeing people not taking up that offer. So Col, if you're able, may I just hand over to you in terms of what we're seeing?
Yeah, of course. Thank you, Jill. So good evening, everybody. I'm Corinne Edwards. I'm the Chief Operating Officer for the Baines locality in Baines, Swindon and Wiltshire CCG, and apologies for the mouthful. So just following on from what Jill has said, I think it comes as no surprise because you're seeing it day in, day out in the media about the pressures in the health and social care system in Baines in particular, but across Baines, Swindon and Wiltshire. And when I talk about the pressures, it's not just about the pressures in the IUH is pressures across social care, pressures across community services, pressures across primary care, etc., and indeed our third sector organisations. This slide just gives you a flavour about why we are seeing those kinds of pressures. As already alluded to, obviously we've got COVID to live with and people being admitted with COVID or potential COVID. This time of year, we obviously see an increased respiratory infections by the very nature of it being winter, which again, just coming back to reinforcing the message about flu jabs, really, really important. In children at the moment, we have seen an increase in paediatric attendances and admissions as a result of respiratory infections, but more broadly, generally around pressures around paediatric attendances and admissions. I think as a result of the pandemic, what we're now seeing is, although when we look at our numbers of admissions and the profile of admissions, although it might not have increased significantly, what we've seen is because of the pandemic, the delays in seeking medical attention means more people are more sick and increased levels of what we call acuity, so more complex needs, which means when they're admitted, they're needing far more care and treatment, and therefore the ability to support people getting out of hospital is more challenging because of our staffing challenges, which is alluded there. Staffing and recruitment and retention is probably the one thing that keeps us all awake at night. As I said, right across health and social care, and it's becoming a daily issue in terms of making sure that we've got sufficient staff to in all our services, and we're doing, I think it's fair to say, in all aspects as much as we can to look at our recruitment and retention for this winter in particular, with specific work focused on that at this moment in time. So I think that just hopefully gives you a flavour of the pressures. I'm sure we'll come back to questions, but if we move on to the next slide. So this one is really, again, how the point earlier around how we work together, how we help one another, how we're good neighbours in our communities, how we look out for one another, and also how we take responsibility for our health and care, and practicing that message around self-care and making sure you have a well-stocked medicines cabinet with the basics, and you'll find information about those on these relevant websites. Our community pharmacies are often a great access point for self-care and providing advice and support. There's obviously Think 111 first, which is online, but there's 111 available obviously via the telephone. And obviously, if you've got concerns about anybody from a health and wellbeing point of view, our community wellbeing hub is ever present and providing that level of support to people who may be vulnerable. And as I said, we have a role to play in looking out for our neighbours and supporting our neighbours as well, and particularly in rural communities. I certainly live in a rural community just off the Mendips, so not far actually from Chew Valley, and that is something we do kind of look out for one another, particularly elderly relatives. So I would certainly encourage that in terms of what we can do to support one another. And then, of course, obviously 999 for life-threatening emergencies and going to A&E. But what we're seeing is generally an increase in people with low-level needs really presenting to A&Es, which don't need to, indeed can get some of that advice via Think 111 first, and indeed our community pharmacies, as I've just said. So the other thing I just wanted to point out there, which is not completely linked with those messages above, but is just to encourage people to look online around the public engagement exercise that's going on at the moment around our shaping our future health and care model. So there's an online survey, and we would encourage you to get the message out about people engaging in that process, if at all possible, please. So I think that's back over.
Yeah, if we go on to the next slide. Okay, so let me just talk to you a little bit about our starting point in terms of the budget, and again give you just a bit of background here for a conversation. So like lots of organisations, 12, 18 months ago, we were hit with a really significant financial issue. For Baines, it was even more difficult for two reasons really. One is we were very dependent upon income, particularly around areas such as road and baths, car park income, commercial estate income. All those three areas probably raised 45 million pounds worth of income in a usual sort of year, as it were. That income reduced to about 15 million pounds. So we had a really significant challenge in the beginning of 2021, and then obviously into this financial year. So, and when you also add on to that actually we are one of the lowest funded councils anyway, we sort of had the perfect storm really around our financial position and increasing demand in things like social care, etc. So, we were faced in April, May, June 2020 with an incredibly difficult situation to resolve, and we had conversations across the board about how, the best way to deal with that. And the consequence of that is that although we did take very swift action in 2021, and we put a recovery plan together, and that really helped us manage the position in 2021. Plus, of course, the government then came in with a pretty significant a recovery package for local government anyway. So we were able during the financial year 2021 to sort of manage that position pretty well actually, and we came in on budget, and we were able also to put some money aside, which has helped us in this financial year manage the ongoing issues about our reduction in income and also the increase in our costs. So because we acted swiftly in 2021, in 21-22, that's really helped us. And what I would say is that you'll hear lots of stories and see lots of stories in the media around HGV drivers. People will go into supermarkets today and they will find that the shelves aren't as stocked as maybe they would have been a couple of years ago. Many elements of our economy have been under very significant pressure, and frankly not operating in the way that they would have been pre-pandemic. Exactly the same is true for local authorities. So we are in a position where we're still dealing with COVID in terms of the pressure on our workforce. We're still dealing with COVID in the context of things like really significant increase in energy costs, really significant increase in the general supply of goods and services. All of that has got an impact on the position both now and as we go forward into 2023 and beyond. So as we've been building up the budget for 2022-23, we've been trying to look at what all of that position looks like and rebasing the budget. So when we come out of the pandemic, hopefully we're in a stronger position, having dealt with some of those pretty clear systemic issues. We're going to start to do this anyway. We're also looking at how we modernise and improve our frontline services anyway. But what you will have seen is that there are some short-term resilience issues around, particularly waste and recycling, where we've got real pressures around supply of labour, everybody chasing the same sort of workforce, some real issues around the number of people around that and also the type of work it is means that actually people are often more susceptible to catching flu and COVID, etc. Because they're working in some quite difficult conditions often. So I guess I'm saying that because I'm trying to appeal, I suppose, for a bit of patience, particularly as we go through the next few months, when we know that there will continue to be some quite significant resilience issues. They're not long term, we don't think, but in the short term, we do need people to understand the pressure that we're under, as I say, like many other parts of the economy. So what you will see, and we'll start doing the consultation around the budget, as I say, in early to mid-December. You'll see the detail around how the budget proposals have been built up. And again, we want people's comments on that, and then it will go through the process in January, February, through a council meeting in February to agree the council tax rise. The government settlement that came out in the spending review is probably better than we thought it would be. So there has been more money that's gone into social care. We haven't seen the detail of exactly how much of that money flows down to our council. We won't see that until probably beginning to mid-December, but we are definitely in a better position now than perhaps we thought we would have been as we were doing our initial projections sort of late summer, early autumn. So there's an awful lot of work that sits behind the budget that you will see. And, I want to record my thanks for, all my colleagues really worked incredibly hard to put together a budget proposal, which I think, is really strong in the context of the challenges that we're facing. But, we will continue to articulate and communicate some of those pressures that we have as we go through the next few months. Next slide. Next slide. Yeah, so this to say just gives a bit more detail on that. So talked a little bit about some of the issues we've got in terms of staffing, drivers. We know there are some issues about that. So we're absolutely clear that we do want to prioritise, and we are prioritising frontline services. But we will keep those communications going. And as we now go into probably colder weather, again, that's an additional pressure which we've got to deal with, and may bring some further challenges that again we'll make sure people are sighted on as we go through the next few weeks. Next slide. So I was going to hand over now to Councillor Romero, who I think is just going to talk to you a little bit about some of the key priorities, particularly on the climate emergency work.
Thank you, Will. Actually, what I'm going to do is slightly cheekily, I'm going to bring Dave Wood into this, as a lot of what's on this slide actually fits into the work that he does. So over to you, Dave.
Yeah, absolutely. Thanks very much, Dina. Appreciate it. Thanks, Will, for bringing everyone up to date on the budget situation, and also looking at our frontline services. And just to reiterate what Will's saying there, even in the context of the extraordinary budget pressures, which is well known to all of you that we're facing as a council, we have a real focus on those frontline services, particularly over the winter period, and delivering the importance of gritting the roads and collecting the recycling and other frontline services. And as a bit more of context there as well, I suppose what we've seen over the last 10 years is local government finance really strangled over the last decade, and a kind of a managed decline of councils all across the country. At Bath and North East Somerset, we're reversing that decline, and we're actually investing more in frontline services as time goes on, and you'll see more about that in the budget, which is coming up as well, both in terms of time to do those frontline works, people on the street, but also in terms of technology and digitizing our services to make those more efficient. And then coming on to this slide, which is the climate emergency this winter. It's obviously a time of great pressure for our crews on the street. The amount of recycling and rubbish goes up hugely over the Christmas period, as there's lots of presents and lots of Amazon deliveries and lots of extra food and that kind of thing. So it's a really important time to keep recycling as much as you can. There's a great deal of pressure on our crews, so anything that people can do to make it easier for them, flattening cardboard boxes, separating out recycling streams, just to make things a little bit easier on the people on the ground, would be hugely appreciated. And it's an important time to reduce and reuse as well as to recycle as well. So particularly if you think about wrapping paper is not something that can be readily recycled, as you'll probably remember from communications last year. So it was great last year. I saw people all across the area who were moving away from normal wrapping paper, going towards brown paper, going towards reusable gift wrap and bags and materials and so on. So just thinking slightly differently, how can we use less?
Yes, so as all of you will remember, over the last year or so, we've been very fortunate that we've been able to work with the key partners, Virgin Care and the CCG, and also the third sector groups, the 3SG, so which is made up, I think, 300 voluntary, sorry, got my teeth in the wrong place there, organisations, and been able to work collectively to provide, very immediate support for our most vulnerable in our communities. And I know that many in this area have also been recipients of help and support from the Community Wellbeing Hub. I think you may remember it from the days when it was the Compassionate Community Hub. So it's just to alert you all to the fact that our Community Wellbeing Hub remains in place, and if people need any help or assistance, then please give us a call. The number's there on the screen, and I know will be circulated with the notes following this meeting too. You only have to call the once, and then through our triage process, we'll be able to make sure you get that help and support that you need. As I said, it can be a range of different matters. It may be about feeling isolated or lonely. It might be around accessing food, or indeed many other issues that are will be as individual as the individuals who need that help and support. So also, if you know of anybody, then please make sure that they are past this number, and and we will collectively do our best to provide what is needed. So the next slide may very well be, I think it's the second to last slide, which is the one where I ask you all to sign up to our various social media channels. I'm sure everybody here already receives our Council eConnect newsletter, and I know that you're probably, avidly following us on Twitter and Facebook, etc., etc. So please, if you're not signed up, then be signed up to our social media. And cascade information from those channels to your communities as well. So I think is the last slide the question slide? Yes, it's the discussion slide. So I think I'll pass back to I don't know if this is Will or Chris to take the discussion on further.
I'll take that on, Dina. Thank you very much. So Sarah's been putting up in the chat as well the direct links to all of the various bits that people have been referring to. So although we will send all that out in the notes that follow the meeting, you can go directly online now if you want, and follow those links through. So the question, we were going to have a brief discussion if colleagues got any questions they want to raise about what are the winter pressures in the forum area. How can we build on our local strengths this winter? So we've had a couple of questions come in so far, actually, and I'm not sure whether, well, I'll put them out there, but I'm not sure who's going to answer them. But one of them is about the impact of fuel rises, both for community transport and community building. So that's the cost of the fuel. But then there's a supplementary question to that about community buildings, which is about the need to increase ventilation and the sort of the split between increasing ventilation and having the heating whacked on full blast. So people will complain if the heating's not, if the thing's not warm enough. So it's sort of a bit of a, I'm not sure whether anybody from the council has got any bright ideas on that, but I just thought those were some questions that we've had from people, which is quite a challenge. The community transport one, well, in fact, I mean, it's actually about people who use oil to heat their buildings with as well. So that should be, when it talks about fuel for community buildings, it's about people who have oil for heating their buildings. And we at Wern, we run a community oil buying scheme, and oil prices have gone up about, I think they've gone up about 70%. So if you have gas or electricity, you may have heard of this thing called the price cap, which stops prices going up too much. Unfortunately, oil doesn't have a price cap, and oil is completely at the whim of the market. So people who are buying oil will be, and we're already aware of people in, when we talk about rural fuel poverty, that's what we mean, is that there are actually people who can't afford to heat their houses, or they'll only afford to heat one room, or they'll be sitting wrapped up in lots of blankets. So again, we can add that into your list of woes, Will, if we can. Is there any...
Yeah, look, I don't know if we can answer that in detail. So that maybe, but what the best thing to do is to look at some of for us to take some of these things away and to bring some information back. I mean, what I would say is, generally speaking, you know, we've seen quite a big increase in cost of electricity, and that, you know, that is feeding through to some of our activity. And like all organisations, you know, we have to manage that pressure within our budget. So, you know, we're not setting out to put up price of activity, certainly this year, in reflection of those costs. But obviously, we're looking at the pressures as part of the 22-23 budget. So, you know, if people have got a list of any specifics, then obviously we'll try to deal with those. I don't know if Mandy wants to add anything to that.
No, I don't think I've got anything to add to it, Will. We're facing very similar situations, aren't we? So like I said, from what you're saying, Chris, it's actually those really important facilities that within very local communities, isn't it, as well as individuals. And I think I would reiterate what Dina said about going through the community wellbeing hub. If there are any people that are vulnerable, individuals that are vulnerable to fuel poverty, I would definitely encourage them to speak to the advisors through the community wellbeing hub. It's a bit more challenging with community buildings themselves, but obviously, having worked with parishes, particularly in communities for many years, I do understand that particularly in rural parishes, a lot of them are on this all oil-based fuel heating, aren't they? And it does cost a huge amount of money sometimes to fill the tanks up in normal times, doesn't it? So like I said, we'll go away and see if there's anything that we can find out of any sort of mechanisms to support those local community groups, but there's nothing I know off the top of my head. But as I said, definitely individuals, please encourage them to go through the wellbeing hub with those particular circumstances.
Okay. Thank you. I mean, it is just that sort of that bizarre contradiction where you're telling us about climate change and about reducing CO2 emissions, and actually we're getting groups that are telling us, actually, I'm going to be cranking my heating up and putting all the windows open, which so I worked with Jane Wildblood in the council a number of years ago, going around putting thermostatic valves on all your radiators to turn your temperature down in the council, because that was one of the things that we did. But it's this is very strange, isn't it, that we're
and it is, and you know, we're balancing those public health messages with keeping people warm in our own buildings at the moment, so we can very much sympathize with that.
Okay, has anybody else got any other questions for any of the panel members? Okay, I've got another one, and again, I'm probably, this is either for Jill or for Corinne, is about people who have been working in care homes, etc., who are not double vaccinated, and what impact are you seeing on that? Obviously, we've got a couple of care homes in the Chew Valley Forum area, one at Cholwell and one at Stanton Drew, sorry. But yeah, I mean, obviously that has an impact on what you were talking about your staffing pressures.
Yes, so we certainly know of some people that have not taken up the vaccine, and the guidance and the lead-in time for this. There was a lot of work done to encourage people. It's incredibly sad, and we know very frustrating for those that actually they then therefore have no option, that they cannot work there. We are doing everything. I should have said, you know, when we are going in to vaccinate our residents, we are offering at that point in time, is there anyone there that would like it? We also are trying to do some targeted support to make sure people can gain the access around trusted sites, which
Is that just me that's lost Jill, or has everyone lost Jill?
Yeah, I think frozen.
Yeah.
Chris, should I come in and just perhaps add a couple of our own, you know, because the council runs their own care homes, a few care homes directly as well. And I mean, the really positive news is the vast majority of staff, you know, I certainly have taken up vaccination. We've had a handful of staff, just to give you an idea of numbers, that we've taken very much the approach that Jill started to outline before she froze, which was encouragement, support, etc. So unfortunately, you know, we have also lost a few, but the numbers certainly in our care homes have been small in number, which is good news.
Okay. Okay, and my understanding is that includes anybody who's volunteering in care homes as well?
Yeah, so if I just come in, actually it's any member of staff that goes into a care home has to be vaccinated, including, you know, maintenance people, independent contractors. They have to prove that they're vaccinated, and I think a lot of homes, well, I think all homes are seeking that assurance if they're, you know, got people coming in like that. So yes, healthcare professionals going in.
Okay, thanks, Corinne. And also, you, and again, Jill mentioned about the booster sites where you can get boosters. So, and again, given the bizarre nature of where the Chew Valley sits in the overall scheme of things, actually we're being offered sites in Bristol. I had mine done in Bedminster the other day, but I think we've got there's some in North Somerset as well that we can access. So they are all over the place. And also it was just to make sure people knew that there was community transport available to take you to booster vaccinations as well if you want. That's a medical appointment, so that's allowed. So we can sort that out as well. Right, either you've stunned everybody into complete silence and you've given everybody the information they need, or yes, because we haven't had it. There's no comments in the chat, Sarah, are there? No. Okay. Well, look, because it's Bake Off final tonight as well, I know you're all going to be wanting to get on and get your tea before Bake Off. I am, anyway. So if anybody else has got any other questions for the panel, please can they raise their hand? If not, I will just do my concluding remarks. Okay. I think you're okay. You're getting a light ride here. By the time you get onto session number 5 in wherever it is in Bath, I think you're going to be they'll be warmed up to you now, and they'll be getting some comments. So, and this lot are not normally this quiet as well, so it's unusual. So, yeah. So thanks very much for coming this evening, everybody, and thanks for spending your time and for all that you're doing for the communities around here as well. And we will keep in touch with you about what's going on, and if there's anything else you need from us down in Chew Valley, let us know, and we'll certainly let you know as well if there's other stuff for Chew Valley. You also, my understanding is you're doing this session again tomorrow, and in Bath Avon tomorrow, Somer Valley on Thursday, Keynsham next week on Monday, in Bath on Tuesday, is that right? And then there's a 3SG specific one, which actually is your last one on Wednesday. So, and it says my notes also ask us that you may be interested in taking part in the Cabinet Office's webinar this Thursday at 11 on keeping communities safe this winter. So we'll send the link out to that as well. The session is for faith leaders, voluntary and community sector groups, and it should also be used for leaders across health, disability, deprived and hidden communities. You will need to register for the meeting, and details will be circulated after the meeting. Thanks, Sarah. So please join the council special budget meeting, which is for everybody. It's not a forum specific meeting, it's for everybody, and that's on the 14th of December at 6 o'clock, and details will be included in the follow-up to this meeting. And then finally, a report to the council's policy development and scrutiny panel is taking place on Monday the 29th of November, and you can listen via a webcast, and details will be sent around. And that meeting is also including an update on the economic strategy. Okay, so we've got a link to send to that. And then the dates for next year's meetings are all to be confirmed. So this is the last meeting of this year. Is that right, Sarah?
Yeah, that's right.
So we'll send you round dates for the next meeting, which will be January, February time, won't it? So yeah, is that okay? All right. Well, look, thank you very, very much, everyone, for coming, and thank you to colleagues from the council. And do say thank you. Is Jill back on the call? No, Jill's not back on the call. Just say thank you to Jill for me, won't you? Thanks, Will, Corinne, Mandy, Becky, for joining us, and thanks as always, Sarah and Alison, for organising it. Oh, Dave, sorry as well. Glad to see you back on the call, Dave. And nice to see various colleagues on the call. So thank you all for coming.